Welcome to BPS Live. My name is Steve Ronan, and I'm a plastic surgeon here at Blackhawk Plastic Surgery. Today, we're going to talk about plastic surgery after massive weight loss. And so that can be a whole host of things, very diverse, but we're happy to have you here with us tonight. And please prepare your questions and send them in now, so we'll be ready to answer those at the end. I'm here with my co-host, Brett, who's here with me every single time. How are we doing tonight, Brett?
I'm really excited to be doing this episode, actually. We get so many patient calls who ask about what to do after weight loss. This is going to be so helpful for them to watch. Before we get going, I just want to remind everyone to follow us on social media. You can see all the latest happenings in the office. We've got before and after photos and information on upcoming events, so please check it out. Back to you, Dr. Ronan.
Awesome. Well, let's talk about just weight loss in general. It's, very timely topic with the new medicines that are on the market now. But really the original and still common way to lose weight was diet and exercise. That used to be more common a long time ago. It used to be pretty normal a long time ago, but our American diet has been sort of gone downhill, and we've all sort of suffered the consequences of that. But diet and exercise used to be the main way people would lose weight, and is still a very popular way. The next sort of category of big weight loss was surgical. And so that would be a gastric bypass or a sleeve. And where I trained in surgery, when I was in the general surgery portion, was at one of the large early gastric bypass centers. So I did a whole bunch of gastric bypasses. Most of them at that time were done open, meaning we'd make sort of an incision from the belly button to the sternum and go in and do a gastric bypass or sort of reroute the intestines. And then as a resident, as a fourth-year resident, I was part of the first laparoscopic gastric bypass done in our institution. And so that was a lot of fun. I really didn't do that much, so it was a couple of attendings doing most all of it. But I was there and sort of helped out for part of that case. And now the sort of newer way that we're getting lots of weight loss patients is with like the Ozempic type medicine and the GLPs. And with those, patients are taking the medicine, not really hungry, and losing really considerable amounts of weight. Some of that loss is muscle loss, and a lot of it is also fat. And so that's something to be aware of if you're on the GLPs, is that there is a fair amount of muscle loss, and so you need to count for that with some weightlifting or some sort of adding muscle while you're losing weight. The effects of the significant weight loss are pretty varied. So you can imagine that if someone lost half of their weight, their skin was this larger person, and then as they shrink down, their skin can only accommodate so much before it just kind of hangs. And how much it hangs, or how loose it is, or how good or bad the quality of your skin afterwards is pretty determined by your age, how much weight you lost, your genetics, your overall health, your sun exposure. All these things sort of go in together. And there's some patients that lose 30, 40, 50 pounds and really look pretty good. And there's others that will lose 50 pounds and really have a fair amount of skin laxity. And it doesn't matter if it's 50 pounds or 300 pounds or everything in between. We've sort of seen it all, and are ready to help you. And so, I had mentioned I was doing the gastric bypasses back when I was in training. And then as I went from general surgery to plastic surgery, because we had this huge center, we really had tons of gastric bypass patients. And most of them with the open gastric bypasses had huge hernias. And so the plastic surgery department actually did all the body contouring and the hernias at the same time. And so we really had a huge volume of massive weight loss patients at our program. And I really got a lot of practice on all that kind of stuff very early. So when someone's shrinking and they have all of this skin laxity, you might think it's a problem. And, it is for that patient. They went from 300 pounds to maybe 170 and their skin sort of hanging everywhere. And they come in, they say, hey, I have all these problems. I have a problem here, here, here. And the good news is that this is a good problem to have, right? The bad problem was when you were 300 pounds. And now that you're 170 with some skin excess, those are much better problems to have because we can fix those. And so we can do some body contouring procedures and tighten that skin up. And that is what really helps the weight loss person sort of complete their journey from their before, which is before weight loss. Their before is when we should meet them, and then their after is at the end of their weight loss journey. So now you've lost all that extra weight and you have all that extra skin, and that's when you come see us and let us help you out. And so what are the typical body areas that people will ask us about? Well, you can kind of go right down the body. So one of the most common is breasts. So any kind of weight loss is going to lead to some drooping. When you decrease the volume in the breast, the skin envelope is still that size, and so it just sort of drops. And so that may present as just a lift if there's enough volume. If most of the volume's gone, we might do a lift and an implant. And if the volume is still too much, we might do a breast reduction, which would be making it a little smaller and higher. So we have sort of a whole variety of breast procedures that we might do for someone who's had a significant weight loss. Also, very common procedure would be a tummy tuck. So anytime you have a weight loss or weight gain and loss or pregnancies, you'll typically stretch out your abdominal wall and create some laxity on the skin. And that is where the tummy tuck comes in, which is one of the workhorses or most common body contouring type procedures. And with tummy tuck, we'll remove extra skin and fat, tighten the abdominal wall to give a much more flat appearance and tighter skin and more athletic looking abdominal wall. And those take about an hour. The other side of the body or the back side of the body also gets laxity, where for people, they'll get laxity on the front midline, and then they'll get laxity on the two sides towards the back. And so the back part of the laxity or the body laxity is kind of like pants slipping down, and the love handle gets loose, the buttock droops, and there'll be laxity of the thigh area, especially on the outer, just below and outside the buttocks. You'll see some sort of creasing and laxity accumulating in that area. So we'll do a lower body lift or body lift for that procedure. And that involves an incision on the backside. We'll make an incision and basically lift up the buttocks and thighs or pull up the pants and then trim off the extra skin. And so that tummy tuck lower body lift procedure, pretty common, and it's used not just in massive weight loss patients, but in other patients who just have some laxity from genetics time or a little bit of weight loss. The upper arms is another popular area for surgery after significant weight loss. It's called a brachioplasty, and it means the upper arm skin. And it might just be extra skin. It also might be some extra volume. And so with the brachioplasty procedure, we'll typically suction out any extra volume and then remove the extra skin with the incision kind of going along the inside or slightly back behind, just inside the arm, so that it hides fairly well. That procedure, the scar is a little more visible because it'll stick out of your sleeve. And so we typically don't do that on patients unless they have a significant amount of laxity to warrant the more visible scar. Most patients tolerate tummy tuck scars, breast scars very easily because they're completely hidden. But with the upper arm, because it's more visible, we want to make sure that there's enough laxity to make it definitely a worthwhile trade for you if you're seeking a brachioplasty. Another common area for surgery after weight loss is the inner thighs. So the inner thighs will become a little bit more lax. Some laxity in females of the inner thighs is pretty common in everybody, or most everybody. But with weight loss, it can really accumulate quite a bit. Typically, before we do a medial thigh lift or inner thigh lift, we'll have already done a tummy tuck and perhaps a lower body lift. And I think that's pretty critical. So the tummy tuck sort of sets a foundation. And when you do a body lift and sort of pull up the pants, it tends to help the inner thigh. And a lot of times with the tummy tuck and the lower body lift, we won't need to do an inner thigh lift. But if someone has a fair amount of laxity, after those procedures, we could do one. And that would involve an incision along the groin crease, and we elevate the thigh skin, remove the excess. And so you'd have an incision on each side of the groin crease, which would help tighten up the inner thigh. Another common procedure after significant weight loss is called a thoracoplasty. And that involves removing skin in the middle or upper back or the sides. And so there's different incision patterns that we'll use depending on where that patient's laxity lies. A lot of times it'll go from the end of the breast under the armpit and then sort of curve around the back going upward in this direction. On those patients, we'll do a thoracoplasty where the incision will be in the shape of a banana, starting at the end of the breast crease, wrapping around under the arm, and then a little bit up the back, not meeting in the middle. And with that, we can sort of pinch the skin on the back and see what the effect would be, sort of lifting that all up. And that tends to remove the excess that would be under the armpit and then along the mid and lower back. Sometimes we'll make the incision right across where the bra strap area is. And that's for someone who has less laxity on the sides or under the armpits and more along the back. And so we'll sort of focus the excision of skin there. And it's pretty easy for us to figure out which one's the most appropriate for you. We'll literally be pinching and grabbing skin and lifting in your console. I'll show you in the mirror, and it will kind of make sense where we want to make the incision to take care of that extra skin along the back. And that's a procedure that we call the thoracoplasty. Another common area we treat after significant weight loss is the face and neck. And that could be really a variety of procedures. Everybody's probably heard the term Ozempic face. I'm not really a big fan of that term. I think it's sort of a social media slur and kind of a nonsense term, if you ask me. But what is Ozempic face? It just means you lost weight. So you take anyone who lost weight and they're going to lose volume in their face. That's only natural. And the volume loss in the face happens to everybody, even if they're not losing weight. So every decade, your face is losing volume. And without any weight loss, probably everybody would benefit from having volume added about once a decade, starting in your 30s. And so if you have a big weight loss in addition to your normal facial volume loss, you're going to accelerate that process. And that can lead to a couple of things, kind of sunken looking lower lids with some deflation jowling, maybe some laxity on the neck. And so depending on where the laxity is, how much the volume loss is, we'll pick the right procedure for you. And it might be something as simple as fat grafting and more advanced, like essentially doing the face or a facelift. And so that's one where we'll work with you during the consult and figure out what's best. And there's some people that have enough volume loss that we might do fat grafting a couple times and sort of plan for that. Doesn't have to be right away. It could be once and then a couple of years later. But volume loss is definitely a part of facial aging already, and it can be accelerated with a significant weight loss, whether that's by diet and exercise, surgery, or one of the GLPs. Let's talk about your consultation for plastic surgery after weight loss. During that time, we'll talk about your medical history and make sure everything's safe for you to have a surgery and what previous surgeries you've had, et cetera. But then we'll talk to you about what are your concerns, what areas are bothering you. Some people it's one area, some people it's 6 different areas. And so we'll sort of figure out like what's bothering you, do an exam and take a look at these areas, and then we'll put together a list. So let's just say we had a list of 5 things on it. And the patients will oftentimes have their priority list of what procedures they want to do first or second and or third. And I'll have a list. And so I'll ask them what is their list? And their list is different than mine because it's mostly based on emotion and annoyance, and so I'm very annoyed at my arms, or I was made fun of for this one, or whatever it is, and they'll have a list, and then my list is based on bang for the buck, super objectively, like what's the biggest change you could make, per procedure, what procedures go well together, which ones are better to do first or second, as far as sequencing procedures. And so I'll ask the patient to prioritize their list, and then I'll share with them my list. And all this happens, obviously very quickly, but a lot of times the lists are pretty close. And so we'll talk about if there's a difference and sort of roll with that. And sometimes they are significantly different, and in which case I might need to explain some more things. But we'll essentially arrive at a plan, and it might be a plan that would happen all at one time. And it might be a plan that we need to stage. So for example, we might do a tummy tuck and a lower body lift at one stage, and breast and a medial thigh at a second stage. And we know that we're not going to do the medial thigh until the tummy tuck and lower body lift are done anyways. And so we know there's going to be two stages, and we could do the breast, with the tummy tuck part or with the medial thigh lift, doesn't really matter. And so those are the sort of like logistical things that we work out with you based on your desires and what you want to achieve and how fast you want to achieve it. We also understand that there's reality. And so what I mean by reality is there's school schedules, vacation schedules, work schedules. And so we have to work around all of those things, planning holidays, et cetera, finances, and figure out what's realistic for you. And so we'll help you come up with a realistic plan to take care of your needs in typically one time, most of the time, and sometimes twice. And so we can help you figure that out during your consultation. Let's talk about your day of surgery on plastic surgery after weight loss. And this day is kind of variable. It really depends. Are we doing 1, 2, 3, 4 things at a time? But typically it begins here at the Black Hawk Surgery Center early in the morning, and you'll come in and get checked in. We'll go back. You'll go to sleep. We'll do the entire procedure. And then you'll wake out and come to our recovery room. We typically don't use drains for the vast majority of our procedures. Probably less than 1% of the procedures will have a drain. And we'll infuse a lot of local anesthesia to keep you numb during the procedure. And for the most painful parts, we use a 3-day numbing medicine. That would be typically in your abdominal wall or around a breast implant. So we'll have a 3-day numbing procedure, which helps keep you pretty comfortable. After you hit the recovery room, you'll be there for an hour or two until you're, awake and coherent and able to have more training and have with your family member, and then you go home. And so when you get home, you'll have typically 4 different pain medicines, most all of which is non-narcotic. So we think with a combination of long-acting numbing medicine and non-narcotic medicines, our patients really do a lot better. Pain control is excellent. And the nausea vomiting problem and other types of narcotic problems is really minimized. And so I think that's been a general trend in plastic surgery, and it's really, really been a good one. And so you'll come back and see us, post-operatively. At about 3 or 4 weeks, you'll be ready to start low impact aerobics. We don't want you to lift anything heavy or strain for at least 2 months after the procedure. As far as working goes, most of our patients are back in about 2 weeks in office type setting. And those patients that work from home often start working very quickly, even the next day. If you're interested in learning more about any of these or other procedures, please feel free to visit us here at Black Hawk Plastic Surgery. We have about a 14,000 square foot facility with a really nice, big, well-equipped office. We also have an adjacent surgery center with 2 ORs and 5 recovery beds. It's fully accredited, sort of like a hospital would be with Medicare and Quad ASF accreditations. We use an anesthesiologist, and you go to sleep for virtually all the procedures that we do here. I think that's a lot safer than being halfway awake in maybe an unaccredited facility. And so that's an important thing to us, your safety. And so we want to make sure that you're not going to feel anything. You're going to hold still while I'm working, And I can be very thorough and not worried about you and how you're doing, because I know that we have a professional watching you the whole time, and I can really focus on the surgery and get a better job done for you. So with that, I hope you guys have sent in some questions, and looking forward to answering them. Brett, any announcements? Are we ready for questions?
I have a bunch of questions that people sent in if you're ready.
I'm ready.
Okay. Let's start with Lila. She asked, do I need to be off Ozempic before getting plastic surgery?
Good question, because that's coming up a lot now as we see a lot of patients who are on the GLPs coming in for surgery. And so the answer is you don't have to be off it that long. But one of the things that these GLPs do is slow down gastric emptying, or another way of saying that is your stomach stays full for a long time. And because it's full, you feel full. And so the standard kind of going backward before these medicines was NPO midnight. So that meant that once you went to bed, you didn't have anything to eat or drink, and you came in the morning, you had surgery. Sort of a standard thing for many, many years. But with these new medicines and the delayed or slow gastric emptying, we need to make sure your stomach's empty prior to you going into the OR. So we'll typically have you stop your Ozempic a couple weeks ahead of the procedure, and then we'll have you on clear diet really for probably the last day or so to allow your stomach time to completely empty, so that when we do the surgery, it's safe for you.
The next one is Serena. Will my results be permanent if I stay on a medication?
Your results are very long lasting if your weight stays stable. So I don't know about the medication, but anyone who has body contouring, like a tummy tuck, if your weight stays stable over time, the result will stay with you. So if you, same thing for liposuction or the other procedures we do, if you're fluctuating your weight, you're going to create some skin laxity. And so the key to longevity for these procedures is just maintaining a relatively stable weight. 5 or 10 pounds, not a big deal, but adding and subtracting 50 pounds a few times might make a change.
Noelle is asking, how do I know if I'm ready for surgery emotionally, physically after weight loss?
So this is where I would say, ask the expert, which is Brett. How would you answer that, Brett?
Well, that's a good question. I think a lot of our patients are on the journey and ready to go when they come into our office. And sometimes they just want to ask a couple questions and might have a little bit time to plan, but we can help you with planning.
I would add to Brett's answer that if your weight is relatively stable and you're bothered by skin laxity and you have a good attitude about the surgery and are excited about making some positive changes for yourself, then it's a pretty good time to go ahead and go proceed with the procedure.
Marissa is asking, does massive weight loss change the way you do body contouring procedures?
Absolutely true. Yes. And what does that mean? Well, when you have a massive weight loss, you have really a massive amount of skin to remove. And so when you're removing massive amounts of skin, the incisions are going to be longer, and they're also going to be more well tolerated. So your typical patient who has a tummy tuck who just is relatively lean and has a couple kids will really try to limit the length of the tummy tuck scar. In fact, I do it very short and get a full result. But when you really have a massive weight loss and a massive amount of skin, the name of the game is to remove as much skin as possible. And so we'll extend our incisions a little bit in an effort to do just that. In addition, some of the procedures are just entirely different. A breast lift with someone who needs a little lift is entirely different than someone who's, really deflated and, has kind of like longer sacks really hanging down pretty far. They're just different procedures. They're typically a little more complicated, a little harder to do, take a little bit more time in the OR, but similar in nature. And, but yes, it is true that the surgeries for massive weight loss are typically a little harder to do and take a little longer, a little more complex, and need a little more incision.
Perfect. I like this one from Denise. My skin feels thin and crepey after weight loss. Is there a procedure that's going to help with that?
Really depends on the body part. So that's going to be one thing. A lot of times the crepey, thinner skin is stuff that I can cut out and throw away. And so that's very helpful. If you look at most tummy tuck patients and you look at the upper part of the abdomen and you feel it, it will feel like thicker and more smooth, and the skin has a better quality to it. And then if you look at the bottom part of the abdomen, the skin's a little more thin and more stretch marks and not as good a quality. And so the bottom part we throw away. So if that's the case, then we'll be throwing away the sort of bad skin and spreading out the good skin. If it's on your face and your face skin's really thinning down, there's different procedures we can do to try and add collagen back into your skin. That'll be microneedling with radio frequency, fractional laser procedures, sort of small ones done maybe serially to try and build back collagen and in a little more thickness to the skin.
Ariel has a good one. I'm still losing a bit of weight. Should I wait until I'm totally stable before surgery?
Textbook answer is yes, you should wait until you're totally stable before surgery, but not entirely applicable. So if you are, very heavy and you're coming down in weight, when you get close to your target, it's not a bad time to start thinking about these kind of surgeries. In addition, I'll tell you that we have lots of patients that come in that say, I've lost all this weight, I still have more to go, but I want to talk to you about these body contouring procedures. And I look at them and I say, well, you really have hardly any fat now. And it's all extra skin. And so they're looking in the mirror, looking at skin hanging and saying, I gotta lose weight, I gotta lose weight. And the reality is that the weight loss is already done. They've done a great job, and they're as lean as they're going to be. And the excess that they see is really just skin laxity. And so it's time for surgery for that patient. And so we can help you evaluate that. As you get closer to what you think is the end of your journey, it's a perfectly good time to come in and see us. And we'll be honest with you about whether we think you need to wait a little bit longer, or sometimes it just takes a while to get into the OR anyways. And so there's a little continued weight loss before we get there.
I actually love that, because when you say that, Dr. Ronan, to patients that they're ready now and they think they still have far to go, you just really get to see the excitement that they've done their job.
Well, it's also, I know exactly what you mean, but it's also they've been working their butt off, trying to do this, whether it's, any of the ways they're doing it. They sort of gone through it and had the willpower to like get to this point, and it's a major accomplishment. And they're looking at their body with this extra skin, thinking, I got more to go, I got more to go. They can never lose that on their own at that point. And so, but they're frustrated with themselves. It's like, gosh, I'm working so hard, I cannot get rid of this extra stuff here. No, you can't. Like, that's extra skin. It's not the extra volume. And so there's sort of a sense of relief when you pinch and you show them, like, look, there's no volume here. This is all skin. You did a great job. You're done. And there's just like this huge sense of relief in them of like, holy crap, I did it, and so then we can go ahead and talk about getting rid of the skin and sort of completing their journey.
That's good. Sienna has a good question. What's the most common mistakes people make when planning skin removal surgery?
We have lots of patients who come in here after having been other places, and they had a significant weight loss, which means a lot of laxity. And they were told to do technology for skin tightening procedures that I don't think had 0.1% result. And so they'll go spend thousands of dollars on procedures that I bet my life are not going to help them. And so that's one mistake people make. When you have had a significant weight loss, the only way to get tight is to have a procedure. And so you kind of need to just accept that that's what's going to happen, and don't waste your money on technology and other different types of energy-based procedures. And I'm the medical director of a laser company, so I help design, test, and get FDA approval for devices. And so I love lasers, and I love devices, and I love how they work and trying to make new ones, but they're totally inappropriate in someone who has a significant weight loss. And so that's the big one. It's like, don't waste your time and money on nonsense when you're in this situation. You're gonna need a good surgeon, and you're gonna need to go attack it in the OR. And that's what's gonna give you the long-lasting result that you'll, love and be proud of and glad you did.
Talia brings up, are there non-surgical options that actually work for loose skin?
The answer is briefly no. So yes, there are non-surgical skin tighteners or different energy-based devices that claim to do some skin tightening. If you have had a significant weight loss, it is extremely unlikely any of these will even be a tiny bit helpful for you. So you can imagine that if a device could shrink the skin 1 millimeter, okay? So if your face was relatively tight and you had 1 millimeter of lift on it, you might see a difference. And that's sort of the order of magnitude we're talking about with these tightening devices. If you have a significant weight loss and I can take off this much skin from your abdomen, 1 millimeter will never be seen. And so if you've had a lot of weight loss, you really shouldn't be thinking of any of these energy-based devices at all. They'll be a total waste of time and money for you. With that amount of excess skin, you're going to have a surgical procedure to remove the extra skin and provide the tightening.
Janessa brings up, what kind of scarring should I expect with post-weight loss surgery?
Really, it depends on what procedure we're going to do, whether it's your arms or your thighs or your belly or your breast. And so you'll have scars in the area that we're doing the surgery. Typically, if you've had a lot of weight loss, the scar will be longer than if you had a small amount of weight loss. So you can imagine if someone lost 20 pounds, how much skin we'd have to take off on the abdomen. If someone lost 250 pounds, obviously we're going to need to remove a lot more. And so that'll take a little longer incision to do that. Most of our scars do just fine. There's some different treatments we can do to help minimize them after the surgery. If they are tending to turn brown or pigment, we could put some cream on to help lighten that up. There are different laser procedures that we can do to help the scarring afterwards, but most of our patients really don't need to do anything at all.
Here's one from Todd. Do you tighten muscles too, or just remove excess skin?
So the procedure, there's two places where we'll tighten muscles with these types of procedures. The most common by far is a tummy tuck. And so when you have weight gain or pregnancy, you stretch your abdominal wall outward. And when you remove a baby or the weight, the abdominal wall becomes floppy. And so there's a procedure we'll do called application, where we tighten the fascia or the leathery stuff around the muscles, and that really pulls them inward. So your waist will go inward and then backward, and it'll become very tight when we get done with application. The other place that will tighten up muscles is in the neck. And so we'll take the two sides of the latissimus muscle and I'll sort of put those together so that they won't band out in the future. They'll just kind of create a nice sling and really tighten up the neck.
This is our last question we have time for from Monique. Can I still work out while recovering from surgery?
Sort of, yes. So we'll wait about 3 or 4 weeks and then do low impact aerobics. And we really don't want you to strain or lift anything heavy for the first 2 months after the surgery. And it really also depends on what procedure we're doing and how many and all those kind of things. But that's sort of a general guideline. What you don't want to do is start lifting heavy things right away and sort of damage your surgery. And so you're going to invest in this. We want to make sure it works out really well for you. And so it's important to kind of tone it down for a little bit. Good news is that you'll want to tone it down after the procedure. You won't really feel like getting up and running around. And so that kind of helps. A lot of people are super worried about stopping to work out for a little bit, maybe because they'll gain weight back or something. It's like, no, you did your job. It's time to let us do ours and tighten all these areas up for you. And then, just let it heal. And then you can go back and do whatever you want. And the good news is that when we do these procedures, you're typically functionally in a better spot. Once you're healed, you'll be able to like move better and sort of exist better in the world functionally.
Great. That was our last question. If you need any help, feel free to email me at info@blackhawkplasticsurgery.com, or you can call our practice at 925-736-5757. Also, if you're interested in scheduling a free consultation with Dr. Ronan, we have an easy-to-use online scheduler. You can scan the QR code on the screen or simply visit blackhawkplasticsurgery.com and click on the scheduling link. And thanks to everyone for watching. I really hope this helps answer your questions, and we hope to see you at the practice real soon. Back to you, Dr. Ronan.
Thanks for watching BPS Live tonight. We had fun talking to you about body contouring and surgery after weight loss. If you have any more questions, please contact our office. We look forward to seeing you on our next show. Thanks for coming.
Bye-bye.